cholesterol, go on and still have a heart attack? Well, the reality is, although total cholesterol, when we look at populations of people, is a great predictor of heart disease, on an individual level, when we look at who comes in the hospital with heart disease, half of people who have heart disease have cholesterol that would have fallen within the acceptable guidelines. Also, when we look at just the LDL, known as the low-density lipoprotein LDL-C, which is in the common lipid or cholesterol panel, half of people who get admitted to the hospital who have a heart attack have actually LDL cholesterol levels less than 100. That's actually considered in the optimal range based on standard guidelines. So what are we missing? Well, one, half people we are able to pick up with the standard testing and risk factors, but we know that there's a whole bunch more that goes on. Part of the difference is how your body packages the cholesterol. The LDL cholesterol, low-density lipoprotein, is a protein that carries cholesterol. Because cholesterol is a fat, it can't dissolve in your blood, which is essentially a simple level is water. So your body makes proteins that package it. You can have big proteins that carry a whole bunch of cholesterol, or you can have smaller proteins that don't carry that much, but you need a lot more of them. It turns out it's the actual number of these particles that are a better predictor of heart disease. It turns out that people who have part of the metabolic syndrome, which is having a low amount of the good cholesterol, carrying more weight across your stomach, blood pressure that's higher, 130/85, or having blood sugar that is in the borderline or pre-diabetic range, and also triglycerides greater than 100 tend to package the cholesterol in these smaller dense LDL particles, which makes them at higher risk. And we can measure that. There's a common test called an NMR lipoprofile that I like using in the clinic. It also gives a regular cholesterol panel with it, the total cholesterol, LDL, triglyceride level with it. You also can measure this by a test called an ApoB. It's the actual measurement of the protein that's carrying it. So both of those can go a long way to help identify. We'll also talk about some of the other testing you can do in the next segment.